Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. If you're on Medicare, you may have noticed an increase in the cost of your prescription drugs. Here to discuss with me is Rich Daly, a senior editor at the Healthcare Financial Management Association. Rich, what's going on with drug costs this year?
Well, overall, Medicare enrollees' drug costs have gone up, and that's according to several new pieces of research. And it's a complicated story. It starts with the Inflation Reduction Act, which was signed into law by former President Joe Biden. That implemented a range of drug changes to Medicare. Best known among those was mandating first-time drug price negotiations. The negotiations will lower costs for 10 drugs, but those lower costs have not gone into effect yet. What has gone into effect are things like a $2,000 cap on out-of-pocket costs for enrollees. It sounds great, but drug insurers have responded to the new rules by implementing out-of-pocket costs short of that cap. The overall effect is a small number, about 5% of enrollees, will be protected by that $2,000 cap, but a much larger number of enrollees now have much larger out-of-pocket costs than they used to have.
So, for folks watching who are going to be affected by this, what can they do about it?
Well, these out-of-pocket costs are expected to increase again next year. So there are two basic things Medicare enrollees should do. One, watch in September for a notice from your drug plan that details next year's changes. This will tell you the cost details for your plan. Also, it's important to keep that letter in case your plan is canceled anytime next year. That's something that happened to a quarter of plans last year. The letter also allows you to enroll in a new plan before the next enrollment period in next fall. The second thing is to carefully review drug plan options during the upcoming annual enrollment period. That runs from October 15th to December 7th.
So, it sounds like there's quite a bit for folks to keep an eye on, especially as they prepare for that open enrollment period that starts next month. That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.